Most people think Viagra and Cialis are basically the same thing. But here's the truth. While both are designed to treat erectile dysfunction, the way they work, how long they last, and even how they fit into your daily life can feel completely different. So, which one should you choose? Let's break it down. The basics. Same goal, different paths. Both Viagra, Sildenafil, and Cialis, Tadalafil, are part of a family of drugs called PDE5 inhibitors. They work by boosting the effects of nitric oxide, a natural chemical your body produces that relaxes the smooth muscles in your blood vessels. That relaxation allows blood to flow more easily into the penis, making it easier to get and keep an erection when aroused. But here's the key. These drugs don't automatically turn you on. You still need sexual stimulation. Think of them as amplifiers, not switches. Interestingly, Cialis has a bonus use. It's also FDA approved for treating benign prostatic hyperplasia, BPH, a condition where the prostate enlarges and causes urinary symptoms. So, in some cases, Cialis is doing double duty. Viagra doesn't have that extra benefit. Onset duration, the biggest difference. Here's where things really start to differ. Viagra, Sildenafil, starts working in about 30 to 60 minutes and lasts 4 to 6 hours. That means if you take it at 8 p.m., you'll likely need to be intimate before midnight for best results. Cialis, Tadalafil, takes a bit longer to fully kick in, around 60 to 120 minutes. But once it's active, it stays effective for up to 36 hours. That's why it's often nicknamed the weekend pill. So, Viagra is more like a planned event pill, while Cialis gives you a larger, more flexible window of opportunity. Some couples prefer Cialis because it takes the pressure off. No strict timing, no clock watching. Lifestyle fit, daily versus on demand. Viagra, taken only when needed, usually in doses of 25 mg, 50 mg, or 100 mg. Cialis comes in small doses, 2.5 mg or 5 mg, that can be taken daily. That way you're always ready without having to plan ahead. Higher doses, 10 mg or 20 mg, are taken as needed, just like Viagra. This makes Cialis more appealing for men who want spontaneity, have frequent intimacy, or also struggle with urinary problems from an enlarged prostate. Viagra, on the other hand, is better suited for occasional use, or if you're testing ED medication for the first time. Food alcohol, a hidden factor. This one trips a lot of people up. Viagra. If you've had a heavy or fatty meal, it may take longer to absorb, meaning weaker or delayed results. So, if you just ate pizza and fries, don't expect quick results. Cialis. Food doesn't really affect it. You can take it with or without a meal and still get the same effect. What about alcohol? Both can interact with alcohol by lowering blood pressure, making you dizzy or lightheaded. But Cialis seems to tolerate moderate drinking better than Viagra. Side effects. What to expect? Common to both: headaches, flushing, nasal congestion, and indigestion. But here's the breakdown. Viagra, more likely to cause visual disturbances, seeing a blue tint, blurred vision, or sensitivity to light. Cialis, more likely to cause muscle aches, back pain, and body stiffness, because it affects smooth muscles throughout the body, not just in the penis. Neither side effect is dangerous for most men, but it's important to know what you might face. Also, both drugs can dangerously interact with nitrates, heart medications, and certain blood pressure drugs. That's why medical consultation is non-negotiable. What do studies say? According to multiple clinical trials and NIH reviews, both Viagra and Cialis are equally effective at treating ED in most men. Satisfaction rates tend to be slightly higher with Cialis, mostly because of the longer duration and flexibility. Some men prefer Viagra because it feels more predictable. You take it, and you know you have about 4 to 6 hours. In surveys, couples often said Cialis reduced anxiety and made intimacy feel more natural, while Viagra sometimes felt more like performance planning. The psychological factor. This is something most people don't talk about. The mental pressure of timing. With Viagra, some men worry, will it still be working when I'm ready? That anxiety alone can affect performance. Cialis eliminates a lot of that pressure with its 36-hour window. So, which is better? Choose Viagra if you want an effective short-term solution, you don't mind planning, or you're trying ED meds for the first time. Choose Cialis If you want spontaneity, less timing stress, daily readiness, or also have urinary symptoms from prostate enlargement. Ultimately, both are safe and effective. But the best one depends on your lifestyle, health conditions, and comfort. Remember, pills are not magic. They help, but lifestyle matters too. Exercise, stress management, sleep, and diet all play a massive role in sexual health. Sometimes improving those can make medication work even better. And we've actually made a separate video on natural ways to improve your erections without relying solely on pills. You can check it out by clicking the I button at the top right corner. And of course, never self-prescribe. Always talk to a doctor before starting Viagra, Cialis, or any ED medication. And that's our deep dive for today. If you found this useful, hit that like button, share it with someone who might benefit, and subscribe for more health tips. Thanks for watching, and take care of yourself.